Okay. Assalamu alaikum, everyone. I hope you're all fine. Okay, so Mubarak has already introduced me. My name is Ashna Binte Nasir. I am currently working as an associate clinical psychologist. I have been working with patients of different clients of different age groups, and I've been, dealing with different mental health disorders. Apart from that, I'm also associated with a school, and I'm working over there as a mental health wellness counselor. I think that's all about me for now. I would like the session to be very interactive today. So I would like if you people, participate and interact with me, that will keep it more interesting. I'll start with, with the introduction, with the topic first. The topic in itself is insomnia. We'll be talking about it. But first, I'm going to cover the sleep disorders in general. So, talking about sleep, can someone over here please define sleep for me briefly, if you have an idea about it?
Hello, if I'm audible enough.
Hello, sorry.
Am I audible enough?
Yes, you are.
According to me, sleep disorder is more related to having problem during sleeping because of some stresses or because of some anxiety related to our daily life problems.
Right, you're very right. But the question was, what is sleep? How would you define sleep? I'll come to the sleep disorders in a while, but first, what is sleep? If you can define it, please. Whatever comes to your mind.
A resting time, giving some rest to our brain.
Okay. Anyone else?
State of unconsciousness, maybe.
Yes, it is. It is a state of unconsciousness. Basically, it's that state of unconsciousness from which we can be aroused, right? We need to be given an external stimuli for that. Can be an alarm, can be someone waking us up, can be, anything happening around us, which just gives an alert message to our brain, right? So any external stimuli which activates our brain. Yes, it is a form of unconsciousness, sleep. Okay, now sleep is very different from coma. We all know that in coma, no matter how many external stimulus are given, the person is not aroused. But in sleep, the person does wake up, right? Okay, there are 4 main stages of sleep. I believe we have most of the psychology students over here. Are we? Even if you're not, I'm going to be using layman terms as well. And if there's a term that you don't understand, please feel free to just leave a message or let me know so that I can explain it to you, right? So talking about the stages of sleep, I am going to just share a picture with you. Let me just, okay. Okay, I am sharing my screen with you, and this is the picture. These are the 4 stages of sleep. Okay, so the first stage over here is the non-rapid eye movement stage. Okay, so are you people aware of the rapid eye movement, the REM stage of sleep? What does it mean? Anyone? Hello?
Non-rapid eye movement sleep is a bit longer one, which is difficult to make the person aroused, as far as I remember. Maybe I could be wrong.
Okay. Yes, it is the stage, but the non-rapid eye movement, the NREM stage, also has 3 stages in itself. The last one is where the third stage is basically the stage where you are in your deepest sleep. So the first stage, I'll start with the first stage, which is the transition period between your wakefulness and sleep. मतलब जब आप जाग रहे होते हो और आप slowly and gradually transition कर रहे होते हो towards sleep. This is that stage, and it's hardly 5 to 10 minutes now. The second stage is where your body temperature starts to drop, your heart rate begins to slow down, your brain begins to produce sleep spindles. Sleep spindles are the waves that your brain sense. These brain waves helps to enhance your cognition. They help in retaining of your memory, long-term memory formation. These spindles work on that, and this period, this stage likes approximately about 20 minutes. The third stage over here is where your muscles relax, and this is again what I said. It's the stage where the deepest sleep occurs. Okay? Last stage is the REM sleep. REM sleep is the rapid eye movement sleep. यहाँ पे ब्रेन बहुत एक्टिव हो जाता है, हम सो रहे होते हैं तो हमारे आई बॉल्स मूव होने लग जाते हैं, राइट? दिस इज बिकॉज ड्रीम्स अकर इन दिस स्टेज. हमारा ब्रेन थोड़ा सा इट गोज टुवर्ड्स द एक्टिव साइड. हमारी बॉडी बहुत ज्यादा रिलैक्स हो जाती है, एंड हमारी आईज अगेन एज आई सेड कि दे मूव रैपिडली, राइट? अच्छा, ये तो हो गए हमारे स्टेजेस, 4 stages of sleep. Now if can anybody tell me how much sleep is required by any person on average?
I
5
just
to
want to
8
have a
hours.
question.
Yes.
I have a question regarding the previous thing. You said कि जितना बंदा ज्यादा डीप स्लीप होता है उसकी मूवमेंट, आई मूवमेंट उतनी ज्यादा होती है. Like apparently we are seeing कि जितनी डीप स्लीप में बंदा है उसको जगाना और ज्यादा डिफिकल्ट होता है rather than the person having a short sleep. So how is that connecting to each other?
Sorry,
Hello?
I the voice. Yes.
I said कि अगर बंदा ज्यादा डीप स्लीप में है और is having a long deep sleep, waking that person would be more difficult rather than waking a person who has a short amount of sleep. So how the rapid eye movement is more increased in long term sleeping?
More increased
in long sleeping, जो last stage 4 है इसमें rapid eye movement तेज increased कैसे है in regard to जो एक short amount of sleep है.
I am
I'm
sorry.
not-
आपकी voice पता नहीं, शायद मेरे इंटरनेट में कोई प्रॉब्लम है. It's breaking a lot for me. If you can just type out the question, that would help.
Just give me a minute.
Thank you.
No, you are actually clear. There's no problem at your end. हो सकता है कि शायद दूसरा end पर हो.
Probably मेरे पास आवाज थोड़ी सी distorted आ रही है. It's like breaking. I think written में होगा तो I'll be able to understand it. By the time he's writing it, I'll go to the next picture. जब तक मैं picture share कर देती हूँ. It's also like talking about the side effects of not having enough sleep, right? So okay. Let me just see if I have the okay. Side effects of missing sleep. Like we all know, if we miss our sleep for like a day, एक दिन भी miss कर देते हैं. For some people, it's okay to miss a sleep for a day or two, but mostly like you get irritable when you miss your sleep. Cognitive impairment, long term effects में cognitive impairment आ जाती है. आपके memory loss and memory lapses होने लगते हैं. Impaired moral judgment, decreased creativity, increased stress, symptoms similar to ADHD. Yes, restlessness बहुत ज़्यादा हो जाती है. Increased heart rate variability, risk of heart disease and stroke. ये सब हम long term में पढ़ेंगे आगे. I'm just going through it very I'm just skimming through it. Increased reaction time. Reaction time is your time to judge anything. Like for example, when you're driving and you need to have you need to have a quick reaction time कि मुझे यहाँ turn लेना है और I need to stop, or what cut do I have to take. So that's your reaction time. अब जब आपकी नींद कम होती है तो आपका reaction time बढ़ जाता है, which means your reaction time gets slowed, right? Then decreased accuracy, tremors, aches. In severe cases, tremors and aches हो जाते हैं. Impaired immune system, risk of diabetes. इसके अलावा obesity, decreased एक minute. I think I have a question here. Sorry. Okay, NREM stage 4 has more rapid eye movement, although at that stage it's difficult to wake up that person rather than a person having small amount of sleep. Kindly brief the REM. Okay, rapid eye movement wala stage is where our brain is active. It's very active and dreams occur. A second, let me just open up that picture for you. Okay, our brain is active, body becomes relaxed and immobilized, dreams occur, eyes move rapidly. So again, what was your question? Screen ko kya ho raha hai? Okay, I'll just go to the question first. ठीक है, तो रैपिड आई मूवमेंट में बेसिकली होता है आपके ड्रीम्स आ रहे होते हैं, आपका ब्रेन भले बड़ा एक्टिव होता है बट इट्स अब्सॉर्ब्ड इन द ड्रीम्स, आपकी आईज मूव कर रही होती हैं एंड like you know the person, it's easy to wake up a person, it's like the person is going to wake up soon from that sleep. Now your question says that it's difficult to wake up that person rather than a person having small amount of sleep. I don't understand what this means over here, but from what I understand आप ये कह रहे हो कि rapid eye movement वाली sleep जो होती है वो difficult होता है उसमें से person को जगाना, which in some cases it can be true, but most of the cases it's the time क्योंकि हमारे dreams जब खत्म हो रहे होते हैं towards the end, तो at that point आपकी sleep, like you know your sleep duration is going to end, right? आपका deepest sleep जो होती है आपकी वो third stage में होती है, non rapid eye movement stage में. REM stage जो होता है it's like you transitioning towards the wakefulness वाला time, so it's not difficult to wake that person from that stage. Mostly people get like you know wake up by themselves from that stage. I hope that answers your question. If it doesn't, please let me know over here. Okay, does that or does that not? Okay, it's clear. Okay, thank you. Baki, I have discussed the side effects of missing sleep. I'm sorry, both the things got very confused together क्योंकि side by side दोनों चीजें चली थी, but I was just like you know to have an idea about what sleep is, how essential it is for us, and what effects does it have on our brains and our like you know psychologically and physiologically, कि हमारी body पे long term effects क्या हो सकते हैं missing the sleep. Now I'm going to go towards sleep disorders. Sleep disorders pe I'm going to very briefly touch upon the disorders, but I'm going to talk in detail about insomnia because that's what our session mainly talks about. So there are 4 sleep disorders mainly. The first one is restless legs syndrome. Now restless leg syndrome, I think the word explains, it's very self-explanatory, but if anyone would like to interact or you know contribute to what do you think it means, so it will be great.
Is it more about moving our limbs while sleeping unconsciously?
Okay, moving our limbs, right? That's what you're saying?
Or mostly legs only?
Okay, ठीक है. Anyone else?
Maybe kind of sleep paralysis.
Sleep paralysis, yes, it can be, but restless leg syndrome की वजह से sleep paralysis हो सकता है, sleep disorders की वजह से sleep paralysis हो सकता है. Sometimes people who have sleep paralysis उनको sleep disorder होना जरूरी भी नहीं है, ऐसे भी cases होते हैं. So yes, it can be that as well. Restless leg syndrome में basically हमें unpleasant you know sensations होती हैं in our legs, and it creates this irresistible urge for us to move our legs while we are sleeping. So we need to stand up, we need to move around. हमें मतलब अपनी position change करनी होती है. We need to move our legs क्योंकि legs में unpleasant sensations आ रही होती हैं, right? इसके भी different types और different treatments होते हैं. वो हम treatments वाले phase में वो sleep disorders के generally treatments more or less same होते हैं, but that depends on person to person and case to case. Okay, next one is sleep apnea. Has anyone ever heard of sleep apnea before?
डे टाइम पे मेरे ख्याल से ज्यादा सोना, मोस्टली डे टाइम पे होता है, बट बहुत ज्यादा स्लीप फील कर रहा होता है पर्सन.
अच्छा, that is narcolepsy. I'm going to come to that after sleep apnea, but a good try, I must say.
I think it's related to snoring something.
Yes, snoring. अच्छा, sleep apnea में let me just put it in simple words. आपकी breathing इंटरप्ट हो जाती है while you're sleeping. स्लीप एपनिया के दो टाइप्स होते हैं, ऑब्स्ट्रक्टिव स्लीप एपनिया एंड सेंट्रल स्लीप एपनिया. ऑब्स्ट्रक्टिव में बेसिकली आपका जो बैक ऑफ योर थ्रोट होता है, इट स्टार्ट्स टू गेट ब्लॉक्ड व्हाइल यू आर स्लीपिंग. So you need to gasp, you need to wake up. आप like you know आपको अच्छा कभी-कभी people with sleep apnea they don't even know what's going on. वो नींद में उठते हैं, उन्हें पता भी नहीं होता हम उठे हैं, you know हमें shortness of breath हुई थी या कुछ, and they wake up, they breathe and then they go to sleep, right? And they don't remember this. एक होता है central sleep apnea. In this case, what happens is our brain fails to send the signals to our sends the signal to our body कि we need to breathe. तो उसमें भी shortness of breath हो जाती है. You gasp, you wake up with a shortness of breath because of the shortness of breath, and you breathe, right? And so sleep apnea is basically when your breathing is interrupted while you're sleeping. Okay. Next is narcolepsy. Narcolepsy is a neurological disorder. इसमें होता है कि आपकी जो the sleep it's dysregulated and you have this urge to sleep during the daytime, especially like आपको during any activity नींद आ जाएगी, maybe while driving a car, while doing any other activity, while cooking or reading a book, any activity during daytime आपको बहुत ज्यादा नींद आएगी. और इसमें आप अच्छा नार्कोलेप्सी में आपके पास कैटाप्लेक्सी भी होती है, which is the loss of muscle tone. Can be due to intense emotions, laughter or anger, like intense emotions like these. अच्छा इसमें नार्कोलेप्सी विद कैटाप्लेक्सी भी होती है, नार्कोलेप्सी विदाउट कैटाप्लेक्सी भी होती है. कैटाप्लेक्सी इज सिंपली लॉस ऑफ मसल टोन. वर्ड थोड़ा सा डिफिकल्ट सा है बट इट्स लाइक लॉस ऑफ मसल टोन बेसिकली. अच्छा, narcolepsy in itself is untreated and goes undiagnosed for years because people usually don't understand कि उनके साथ हो क्या रहा है ना. They are not able to sleep during the night and during the day they'll have this irresistible urge to sleep and they will sleep anytime anywhere, right? अच्छा, this I have briefly touched upon 3 of these disorders. Now I'm going to go to insomnia, which is the last one. Insomnia, I'm sure it's a very common term. Most of you must be very aware of what insomnia is. So can somebody please explain over here, try and explain what insomnia is.
Having problems while sleeping at night mostly.
Okay. Anybody else?
Ashna, am I audible?
Yes, you are.
Okay.
She's
So
right.
insomnia.
Or who is it?
Yep. So insomnia is it's like finding it very hard to fall asleep, and it's like कि पूरा दिन फिर जब आप उठो तो you feel very tired because of this lack of sleep जिसके अंदर though you want to get sleep, a proper sleep, but you can't. So yeah.
Oh, ठीक है. Very well put, and it was very well explained, I must say. Basically, it's when you find it hard to fall asleep and staying asleep as well. मतलब सो जाना can sometimes not be that difficult, but staying asleep can be. अच्छा, insomnia has 2 types. Types तो मैं इसके 2 forms कहूँगी. It's acute and chronic over here. Acute is acute का जो diagnostic criteria होता है, it's like from 1 night to a few weeks where you haven't slept, and chronic is at least 3 nights of staying awake, and it goes for more than for 3 or more months. So acute and chronic insomnia होता है, and इन दोनों का डिफरेंस, डायग्नोस्टिक क्राइटेरिया का डिफरेंस है. अच्छा, इनके ट्रीटमेंट्स की भी हम आगे बात करेंगे. अभी आई एम जस्ट एक्सप्लेनिंग कि acute is short term, chronic is long term. अब टाइप्स इंसोम्निया के 2 होते हैं. The first one is primary, second one is secondary. Can somebody try and let me know what is primary insomnia and what is secondary insomnia over here? Acha, okay, I'll explain. Okay, primary insomnia is basically where your insomnia is not linked to any other health condition, right? It's probably because of some big life event coming up, or you lost a job, or you're grieving. It's like temporary, and it's it's not related to any other health condition. But secondary It can be because, like, the sleep issues can be because of any health condition which exists in your body, can be due to any medication, can be due to substance use, like, and medical conditions, maybe usme health conditions, maybe cancer ho sakta hai, arthritis, asthma, any other body pain. So that's like primary and secondary insomnia. I hope that's all clear idhar tak. अब हम इसमें like further divisions में जाएंगे कि insomnia उसमें दो types हो गए, primary and secondary, and now I'm going to explain different kinds of insomnia, which is first is sleep onset in insomnia. Sleep onset in insomnia is where you have trouble falling asleep, जहाँ पे आप सो नहीं पा रहे हो, आप कोशिश कर रहे हो सोने की, but you're not able to sleep. The second one is sleep maintenance insomnia. I think that's very self-explanatory. Sleep maintenance मतलब आप सो गए हो लेकिन maintain नहीं हो पा रही है आपकी नींद, right? So that's sleep maintenance insomnia. The third kind is the mixed insomnia, which is जिसमें आपको staying asleep and falling asleep, both of them are included. दोनों ही चीजें नहीं हो पा रही. And the third is paradoxical insomnia. Paradoxical insomnia में basically ये हो रहा होता है कि आप सो रहे होते हो, but your brain is so alert during that time that you underestimate the amount of time you have slept. मतलब आप सोए हो भले, but you will be like, I'm very tired, and I don't like, you underestimate the amount of hours you have slept, and you go like, I'm very tired, and I didn't feel like I even slept. Right? मतलब आप अगर 8 घंटे सोए हो लेकिन your brain was constantly up, it was constantly alert, and you were disturbed, so you were going to say, I'm very tired, I don't think I got any kind of sleep, right? So that was paradoxical insomnia. Any questions so far, guys?
I have a question regarding the previous stage before the paradoxical one. I have a question regarding the stage before paradoxical. You said it was
The
difficult
mixed
to
insomnia?
even, yeah, in which you said that it's difficult to maintain sleep and also it's difficult to fall in sleep. So, like sometimes the person is able to fall asleep, but he cannot maintain the sleep. Now, there are some chances the person can sleep for a good amount of time, but he cannot maintain that particular time range. Is there something regarding that only?
This is not like mixed insomnia then. That is like you are able to sleep, but you're not able to maintain your sleep. That's sleep maintenance and insomnia. You're able to fall asleep, but if you're not able to fall asleep, that's sleep onset insomnia. कि onset ही नहीं हो रहा ना sleep का, sleep start ही नहीं हो रही. So that's not mixed insomnia. Mixed is जहाँ पे आप ना सो पा रहे हो और ना आप उसको सो ही नहीं पा रहे, तो maintain ही नहीं कर पाओगे, right?
So is it related to कि मतलब आप सो रहे हो फिर 10-15 मिनट बाद आपकी आंख खुल रही है या किसी भी वजह से किसी भी
that's sleep maintenance. That's sleep maintenance, because sleep maintain ही नहीं हो रही ना, it's not in a go, it's being disturbed continuously because of any external reason and internal reason, but it's being disturbed, it's not maintained.
Okay, thank you.
Right? I hope that was clear. Okay.
Yes.
Now moving on towards the etiology. Etiology is the causes of insomnia. Okay, there are again primary causes and secondary causes. Primary insomnia क्या था? Can somebody explain again? क्योंकि primary causes are linked to it. Come on.
Primary insomnia is basically when it is because of the environmental factor or not because of this side effect of any drug.
Yes, yeah. It's because of you yourself. Like, it's not because of any third health condition, right? So primary insomnia के causes क्या हो सकते हैं? Can be stress related to any big life events, can be things around you, specifically phones. आजकल phones बहुत they're one of the major reasons why people face insomnia क्योंकि distraction इतनी ज़्यादा है. Apart from that, there is noise, maybe your bed isn't comfortable, maybe you have bad memories associated with your bedroom or your bed, or maybe there has been a change in your sleep schedule. आपको कोई jet lag है, you have just shifted from one country to another, or maybe you have just shifted your work, like you had a different routine in during that time and you have a different routine now at your work. So uski wajah se bhi, work rotations ki wajah se bhi aapki primary insomnia ho jata hai. And of course genes. Sometimes insomnia also runs in your families where you're not able to sleep. Now secondary causes can be mental health issues. First of all, what mental health disorders do you think can can be causing insomnia?
Childhood trauma,
Okay, childhood trauma and
anxiety,
anxiety.
yes,
Yes, anxiety, depression. Basically, more like many psychological disorders, they do contribute towards insomnia. Depression, anxiety, topping them all. But yes, childhood trauma, bipolar disorders, maybe when you are in your depressive state, you're likely to have insomnia, and because of that depressive state, so it's going back to the depression wali side. Apart from that, secondary causes और क्या हो सकते हैं? Medications हो सकती हैं, any pain, any other physiological health condition, can be excess use of caffeine or drugs or alcohol. इसके अलावा, if your thyroid is increased, hyperthyroidism, it also causes insomnia. It's one of the physiological reasons. इसके अलावा, any other causes do you think that might be causing insomnia?
Ashna, जो लोग cigarettes पीते हैं, वो secondary cause में जाएगा या primary, जिसकी वजह से lack of sleep होती है?
Secondary में जाएगा. The reason why it's a third habit, it's because of a substance use. It's an external thing, like it's not related to you or your environment, but something that's being added to the environment and that you are adding it. So that's secondary insomnia. करना, drugs लेना, alcohol लेना, medications जैसे induce कर रहे हैं हम अपने अंदर. So these are all contributing towards insomnia. So yes, secondary. Apart from that, some ladies, they face insomnia while they're pregnant, Alzheimer's, dementia, ADHD, and the list goes on. Even PMS and menopause ke stages mein, insomnia is very common amongst ladies. Also, one more thing, research suggests that females are more likely to be dealing with insomnia than men. It's not like men don't, but females get it more often. Apart from that, who else is at risk? We are going to the next topic right now, which is like who is at the risk of getting insomnia. So the first one was, as I've already mentioned, that women are more at risk than men. Iske alawa, people with long-term illness, they are likely to face insomnia. Mental health issues, again, they always contribute towards insomnia. And again, working shifts, aapki rotational shifts, and people who have daytime shifts, for a week, and the other week they're going for the nighttime shifts. For example, doctors. इन लोगों की rotational shifts होती हैं, इसकी वजह से they are very they get this insomnia because उनकी routine नहीं set हो रही होती, right? So these people are more at risk of insomnia. अच्छा, apart from going to the symptoms, next, symptoms. Can anybody please tell me what are the symptoms of insomnia? Or just try. How can you tell that a person has been insomniac?
Can it include constant?
Sorry?
A person could have a constant worrying. He's constantly worried about things that might doesn't let him sleep, or trying to having different sleeping pills to have that particular sleep, but he's not to have that.
Right, right. Anybody else? Okay.
fatigue,
Fatigue, yes. When the person is very tired, you can tell that the person, not always, but because of insomnia, आपको fatigue हो जाती है, आप बहुत tired हो जाते हो. It's very natural. आपका, you have this grumpiness in your मूड, आप इरिटेबल हो रहे होते हो, आप क्रम्पी हो रहे होते हो, आपको कंसंट्रेशन में बहुत प्रॉब्लम्स हो रही होती हैं, आपको मेमोरी रिटेनेंस में बहुत प्रॉब्लम हो रही होती है, नॉट एबल टू रिकॉल स्टफ विच यू नो वेरी वेल. कहते हैं ना एग्जाम्स में यू शुड टेक well sleep, because if you don't get proper sleep you will not be able to recall what you studied. Your brain needs time to restore that all that information and to bring it back to your conscious mind. So for that, like in such cases आपकी memory recall नहीं कर पा रहा होता, आपका mind बिल्कुल भी memories recall नहीं कर पा रहा होता, आपको concentration में बहुत issues आ रहे होते हैं. Now इंसोम्निया के साइड इफेक्ट्स क्या हो सकते हैं, कॉम्प्लिकेशंस क्या हो सकती हैं, एनीबॉडी?
Lack of concentration, tiredness throughout the day.
Right. Lack of concentration, and what was the other thing you said?
Tiredness throughout the day.
Sorry?
Tiredness throughout the day.
Tiredness, yes, tiredness.
डेली रूटीन इम्पेयर हो जाती है आपके,
क्या इम्पेयर हो जाती है? सॉरी,
डेली रूटीन जो भी आपकी होती है,
बिल्कुल आपकी डेली फंक्शनिंग इम्पेयर हो जाती है, आप यू आर नॉट एबल टू कैरी आउट योर डेली एक्टिविटीज. एनीथिंग एल्स? फिजियोलॉजिकल क्या होते हैं हमारे फिजियोलॉजिकल साइड इफेक्ट्स, क्या होते हैं इंसोम्निया के? हेडेक,
हाँ, बैक एक होता है, मसल्स इश्यूज हो जाते हैं
हाई हो
आपको,
जाता है, हमें हार्ट स्ट्रोक के चांसेस बहुत बढ़ जाते हैं, डायबिटीज, वीक इम्यून सिस्टम, अगेन ट्रबल फोकसिंग, कंसंट्रेशन. इसके अलावा इंसोम्निया की वजह से यू हैव अ डिक्रीज्ड लिबिडो एज वेल, which is like your sex drive decreases very, like very rapidly decreases. Apart from that, it ages your skin, you look older than you actually are because your face gets dull with time. Anything else with apart from this? Or kya
Does
kya?
it include also the constant irritation in your mood?
Yes,
like very petty
constant
things
irritation,
start
you're
irritating you.
Yes, you're constantly irritable. And also a study, I was just recently studying somewhere that a study suggested that it causes loss of brain cells, and these brain cells, like those brain cells once lost, it's not like we cannot make up for that lost sleep. It's like those brain cells are gone and you cannot just make up for that lost sleep. So I found that very interesting. It was something I recently came across, so I thought I should share it over here. So these are some of the effects of insomnia, long-term effects, and these are definitely going to affect your daily functioning, your relationships, your personality, your work, everything. So yeah, iske alawa, now going towards the prevention. How can we prevent insomnia? What do you think? What can you do to prevent insomnia? Can anybody else try? Like, there are just 3-4 people talking. I'd like everybody to participate, please.
I just need to confirm one thing. We have mostly heard from our parents and from many other people that रात को फोन यूज करने से mostly आपकी नींद डिस्टर्ब होती है, और it could be a reason to cause insomnia or something like that, कि वो आपकी sleep pattern को बहुत affect कर देता है, कि वो मोबाइल की जो rays होती है. Can you just help regarding that logic and
it
this
is
insomnia?
actually true. These rays, the screen light which you use while you're on your bed, इससे क्या होता है, आपका जो ब्रेन होता है वो दोबारा एक्टिवेट हो जाता है. इवन व्हेन यू वांट टू गो टू स्लीप, दिस मोबाइल, लाइक अभी जो मैं प्रिवेंशन की बात करने लगी थी उसमें एक पॉइंट ये भी है कि व्हेन यू गो टू स्लीप यू कीप योर ई-बुक्स एंड योर मोबाइल फोन्स एंड योर टैब्स, यू पुट देम असाइड. You use your bed only for your intimate relations and your sleep. Like, people do it because they want to have their food on bed. They want to, read on their bed. They have to watch movies on their bed. हर चीज bed से associated है. bed के साथ association ऐसी बन गई that we are going to do everything on our bed, right? So it is why, like, this is why it is said that, you keep your bed limited to your intimate relations and your sleep only. And when you're really sleepy, then you go to your bed. Why? Because then you'll be able to have a nice peaceful sleep. अगर आपके पास distractions मौजूद हैं bed पे ही, तो फिर तो you're not going to be able to sleep properly at all. So this was one of the point why which helps in prevention of insomnia, which helps in lowering that phase, the insomnia wala phase. So yes, it is very true that mobiles, they do cause insomnia, and people these days, they are very much involved in phones, videos, phones, social media. Iski wajah se bahut zyada distraction and they're not able to sleep. So yes, that is a very valid point. Does setting a routine help? Yes, it does. You need to, psychologists say that you need to set a routine कि आप एक like daily का एक time set कर लो कि इस time पे I have to go to sleep and I have to wake up at this time. You don't change it for a few days or a few weeks. You follow that routine. उससे क्या होगा that आपकी you develop a routine slowly and gradually. You develop a routine and it kind of gets shaped automatically. So yes, that's also one of the ways to prevent it. Anything else
मैं एक
you would
पॉइंट
like to
ऐड करना चाह रही हूँ।
yes?
बहुत दफा ऐसा होता है कि जब हम ना सोने की वजह ये भी देखी जाती है कि उनके अंदर एक एंजाइटी रहती है कि अगर वो सो जाएंगे तो वो कोई चीज मिस कर देंगे।
ऐसा
फैमिली में अगर है तो उन्हें लगता है कि वो सोने से उनको सब कुछ मिस कर देंगे वो, तो इसकी वजह से वो सो नहीं पाते।
Basically, these are anxiety provoking thoughts, and yes, many clients do complain about it when they come for therapies and all, कि हमें ये लगता है कि अगर हम सो गए तो we'll miss out on something grand, something huge. That's why we cannot sleep. For this हम क्या करते हैं, हम clients को एक तो we tell them, हम इसको basically stimulus control करवाते हैं। इस तरह के anxiety provoking thoughts जो होते हैं हम उसको control करवाते हैं कि आप बेड पे लेटो, आप कोशिश करो सोने की। when you're not able to sleep within the 15-20 minutes वाला time period, you get out of your bed, you go do something relaxing or make a to-do list. रोज रात को सोने से पहले you make a to-do list and every night before going to sleep आप पिछले दिन की to-do list लो, उसको check mark करो कि मैंने ये काम set किया था, for the next day I have done these and now for the next day I have these tasks to achieve. And you think about those tasks that I have to wake up tomorrow morning, I will be doing these tasks. And आप automatically आप अपने concern से distract हो जाते हो. But yes, it is one of the very main factors why people don't sleep. They have this fear of missing out on something which can always be worked on. You can always maintain a diary, you can make a to-do list, as I said. Different stimulus control techniques आप use कर सकते हो in such cases, right? Then somebody has said taking naps throughout the day makes it difficult to sleep at night. Yes, of course. You need to avoid, to prevent insomnia, you need to avoid taking naps during the day. Even if you limit that time to मुझे 15 minutes or 20 minutes, not more than 30 minutes की आप nap ना लो. 30 minutes से ज़्यादा की nap ना लो. 30 minutes limit कर दो कि इतना है, वो भी बहुत ज़्यादा number और बहुत frequent naps ना लो. You take one or two and after 3 or 4 p.m. you stop taking naps, right? This is one way to prevent insomnia. Another can be you don't eat heavy meals at night. उसकी वजह से भी restlessness हो जाती है, sometimes acid reflux हो जाता है, जिसकी वजह से you are not able to sleep for the whole night. But yes, taking a light snack before bed, can be a granola bar, can be green tea, something very light if you want. If not, you can always you can just have a nice meal, a light meal, and that meal also needs to be taken 3 or 4 hours before going to bed so that it gets digested and all. There are reasons why doctors talk about this. There are reasons why it is said that you have to follow a routine, because it does affect your body and your brain in different ways, right? Acha, iske ilawa, anything else you think that we can add to the prevention?
Soft drink, chai, coffee,
Yes.
उसको सोने से पहले
That
ना
have
avoid करनी
caffeine,
चाहिए।
soft
क्योंकि
drinks,
अक्सर लोगों की
sodas,
आदत होती है चाय पीने की।
होती है, बिल्कुल होती है. Some
Yes.
days I think it's fine, but you try. जैसे कुछ लोगों का होता है कि they don't have such issues, but if you know you have an issue and you have this issue of sleeplessness and restlessness at night, you avoid these things at any cost, because then they add up to the sleeplessness wala factor. अच्छा, इसके अलावा sleep hygiene. I'm sure many of you must be knowing what sleep hygiene is. So can someone, medications maybe, yes, medications can be used, लेकिन वो treatment वाले phase में आ जाते हैं. अभी हम prevention की बात करें कि हम insomnia को कैसे, like what we can do ourselves or help our friend or any loved one who is going through that phase, कि हम उसे किस तरह से अपने तौर पे कर सकते हैं. Medications तो फिर हम doctors और experts के पास चले जाते हैं ना. तो अभी we are talking about what we can do on our own, right? तो हम स्लीप हाइजीन की बात कर रहे थे. स्लीप हाइजीन, कैन एनीबॉडी एक्सप्लेन what is it? There are some applications as well that help with relaxing the mind so that we can go to sleep, like calming sounds. Yes, of course, as I said, जब आपको नींद ना आ रही हो या you find it very difficult, you go do something relaxing, या आप एक meditation music रात को लगा दो, या you read a book till you feel sleepy, like आप थक जाओ, you feel like that your eyes are like now getting closed, then you go to sleep. You leave your bed if you're not able to sleep. Yes, there are some apps, there are some certain activities, relaxing activities, so that can be done as well. Again, going back to hygiene.
I have a small question regarding that. The way you said कि आप अपने आप को distract करो, book पढ़ना शुरू करो, but usually before exam जो एक रात पहले जब आप सो रहे हो तो जिसमें आपको usually कुछ लोगों के साथ प्रॉब्लम होता है, बहुत ज्यादा वरीनेस और बहुत ज्यादा टेंशन होती है जिसकी वजह से उनको नींद नहीं आ रही होती है. एंड समटाइम्स सिर्फ नींद नहीं आ रही होती तो इसलिए उनको फोकस करने में इशू रहा होता है, वो कुछ और उस वक्त नहीं कर पा रहे होते. एंड सम पीपल हैव प्रॉब्लम, they used to walk, they walk fastly just because they're having that tension. So how to calm a person at that situation? How would that be possible?
In such cases, positive affirmations can help. Yes, behavioral techniques, behavioral interventions can help. You can use rationalization over here. You know, if this is going to help you achieve what you are looking for in your exams, then you go ahead. If not, do you think it's going to benefit you in any way? No, it won't, right? You sort of use rationalization with those people, with that person. Yeah, if they're not able to relax, exam ka, to why are they not able to relax? Tell them to give reasons. Have you not prepared? Have you not followed a schedule? Have you not studied like before? Can be an underlying reason ना कि क्यों उनको ये problem हो रही है, किस वजह से वो face कर रहे हैं ये restlessness वाली.
It could be a part of nature.
Sorry?
It could be a part of nature. Like they would be fully prepared. They would be having. They would be prepared everything. But still they have that worrying nature. It occurs every single time before it.
And if it is very frequent, yeah, if it is like every time they have this restlessness, even if they are fully prepared, and if they are like, you know, so it's better for them to go for some counseling maybe, or maybe go to someone whom they can talk to, who can give, like, teach them interventions, how to distract themselves, how to like, you know, because if it is very frequent, it means that they need to work on it and it cannot be left. Because अगर उनकी सारी तैयारी है, हर चीज है, and even if rationalization is not working in that case, then maybe counseling or therapy, I would say, can help them, right? वो हम treatment वाले phase में बात करेंगे, right? I hope I'm clear.
Yes, ma'am. Thank you.
You're welcome. Okay. इसके अलावा sleep hygiene, ये topic नहीं, sleep hygiene बीच में रह जाता है. तो sleep hygiene, yes. Can anybody tell me about sleep hygiene if you know what it is?
एक प्रॉपर रूटीन फॉलो करना है, जैसे सोने से पहले आपने ब्रश किया, आपने अपना बेड प्रॉपर तरीके से साफ किया, उसको मेंटेन करके, देन यू नो एक एनवायरनमेंट क्रिएट करना जो आपको
create. Yeah, good, very good. It's like this is it, but it's subjective. मतलब किसी के लिए maybe dim lights in the room, they can be very relaxing and very calming. किसी के लिए अंधेरा हो कमरे में, तो that's very calming. किसी के लिए रूम में लाइट म्यूजिक हो, किसी के लिए बिल्कुल सन्नाटा हो, तो they would, like, you know, find it relaxing. It is kind of subjective, but yes, you need to see what gives you comfort. You make sure that you have that comfortable surrounding before you go to sleep. If you want your bed to be made, if there's a particular fragrance that you like, you know, lights pay, noise pay. If you think you are easily distracted, so you use a sleeping mask, earbuds, anything you like that, you know, might be might make you comfortable and make you help you in sleeping comfortably. Acha. Sleep hygiene may be keeping the room clean and comfortable, lights are off, relaxing. Yes, very right. Sleep hygiene is taking steps to help you improve your sleep. Yes, exactly. It is basically that. And what steps, that depends on you. Whatever makes you comfortable in your bedroom, right? And as I said, you associate only sleep and sleep to your bed. You don't make your bed a place where you're doing everything. कि खाना भी इस पे खा रहे हैं, तो movies भी इस पे देख रहे हैं, तो Netflix and chill भी उस पे हो रहा है, तो friends के साथ gossips भी उधर ही हो रही हैं. No, you limit your bed only to sleep, and other activities can be done somewhere else, so that आपकी bed से association सिर्फ नींद की हो, right? So with this we are done with the prevention wala phase. Now I'm going to go to the treatment, which is the last topic, and then we'll go to the feedback and question answers. So diagnosis तो मैंने आपको बता दिया कि diagnostic criteria होता है acute and chronic का. Acute insomnia जो होता है, in that case mostly treatment की requirement नहीं होती. मेडिकेशंस भी जो शॉर्ट टर्म मेडिकेशंस होते हैं, क्योंकि एक्यूट शॉर्ट टर्म होता है, कुछ टाइम का होता है, एंड इट्स नॉट नेसेसरीली कि किसी लॉन्ग टर्म या किसी हेल्थ कंडीशन की वजह से हो. तो समटाइम्स ओवर द काउंटर पिल्स आल्सो हेल्प, बट मोस्टली ये स्लीप हाइजीन एंड जो प्रिवेंशन में हमने जो टॉपिक्स डिस्कस, जो पॉइंटर्स डिस्कस किए हैं कि ये हम कर सकते हैं टू हेल्प टू गेट अ good night sleep. So you can follow them, and I think counseling apart from that would help in acute insomnia. But chronic है, अगर किसी other mental health condition या physiological condition की वजह से, then maybe you need to go to a doctor, a psychiatrist, and if it is psychological, it's because of any mental health illness, then you need to go to a psychologist, and the psychologist is most probably going to use CBT, cognitive behavioral therapy, or behavior therapy upon you. इसमें क्या होगा कि if there are any habits or any patterns that you have been following which is making the situation worse for you, so they help you identify them and work on them. तो इसमें stimulus control भी आ जाता है, sleep hygiene भी आ जाता है, thought control भी आ जाता है, any thoughts that might be unhelpful and unpleasant for you, working on those thoughts भी आ जाता है. And yes, so these are the treatment phases. इसके अलावा अगर physiological है या अगर आप psychiatrist के पास जा रहे हो, बहुत mild to moderate हम CBT and behavioral therapy से कर लेते हैं manage. But if it is severe, and like in cases of bipolar disorders and other disorders जहाँ पे it's not like the person is not able to control and it's not able, is not able to manage, या person is state में ही नहीं है कि they can work on it, then medications of course, और वो doctor prescribe करते हैं, doctors suggest करते हैं. I'm not going to take names of any medication, and it's highly discouraged to you take any over-the-counter medication, especially if you don't have any prescription or if you have not talked to an expert about it. So yes, this brings us to the end of our session, and I am sure everything was clear. If not, you ask me, and we are going to go towards the question answer session. If there's any feedback or question answers, just let me know and I'll be really happy to answer them.
यहाँ पे हम लोगों ने पता है जब हमें स्लीप मेंटेन करने में मुश्किल हो रही थी, तो
Sorry?
वो स्लीप मेंटेनेंस में जब हमें मुश्किल होती है, डिफिकल्टी होती है, तो हम उसके लिए क्या कर सकते हैं?
Sleep maintenance में तो first of all you identify what are the triggers, what is the reason, is it thought, is it some, again वही चीज कि अगर आप पहले identify करवाते हो, you go to a doctor or maybe a psychologist. First you try and work on it yourself कि मैं क्यों sleep नहीं maintain कर पा रही हूँ. Is it any external factor? Is it the lighting of my room? Is it the location of my bed? Is it the position I am sleeping in? If it's that कि आपकी sleep maintain नहीं हो पा रही, you work on that. If not, if there's nothing external in your room, not in the environment, then maybe there's something disturbing you from within. Might be something from the past which is maybe which is maybe suppressed, which is not coming to your conscious, but it's there. You go to a psychologist for that, and maybe there might be any physiological condition as well. You go to a doctor for that, but first you need to start and try to identify within yourself that what is the reason about it. Why am I not able to maintain my sleep? अगर मैं सो पा रही हूँ तो ये maintain क्यों नहीं हो रही, इसका क्या reason? And if it's frequent, then you need to go see a doctor or a psychologist, or maybe talk to someone if you really want. Did I answer your question?
Okay, yes. Thank you.
Any other questions or feedbacks? I'd love to have your feedbacks firsthand, but it's okay if you're not comfortable. You can always send them to me anonymously through Mubarak.
It was a really good session. Luckily, it's helping me out because I need to prepare regarding this topic for an exam. And one more question I would like to ask, that if someone has the genetic problem of worrying, like worrying, like रात को सोने से पहले बहुत पेटी इश्यूज की टेंशन ले लेना और बहुत छोटी छोटी बात पे लाइक आपके पेपर की अच्छी खासी तैयारी है, इसके बावजूद भी आपको कोई चीज डिस्टर्ब कर रही है, आपको सोने नहीं दे रही, and that's running from inheritance.
How do they know that it's inherited? Have they seen it
like
as a pattern in the family?
Yeah, like they've seen their parents, that it usually happens कि जब उनकी कोई ऐसा इवेंट होता है, कोई फ्लाइट होती है या कुछ भी, मतलब बहुत नॉर्मल सी इवेंट्स होते हैं जिनमें वो ये स्लीपलेसनेस वाला इशू होता है और बहुत ये प्रॉब्लम्स होते हैं. So can it be cured by a psychologist or by such therapies?
Yes, it can, because
this is something.
Most of it is related to your thoughts. It's your thoughts which you can't control. And CBT, cognitive behavioral therapy, cognitions are your thoughts. It's your mental processes, right? So cognitions पे जब काम होता है तो cognitive behavioral therapy, वो आप cognition से start करते हो, behavior पे आते हो, and it changes your sort of perception about it, your behavior towards that particular situation. So yes, CBT always helps, but you need to communicate it very clearly to the person you're going to for therapy, and you need to tell them what goes on, and if you discuss it with them, that what's the issue and how it can be worked on, how you can improvise it. So they are going to help you, but then you need to be very clear what the goal is and what you need to do to achieve that goal, right? And in CBT is very focused, solution focused, in a very जैसे कहते हैं ना हम के बिल्कुल टारगेट बेस्ड, गोल बेस्ड, कि हमें ये गोल अचीव करना है, and we are going to work on this goal first. So you go for CBT and you go to a psychologist, and it's always going to help you with it.
Thank you, ma'am. Thanks a lot.
You're most welcome. Any other questions? Oh yes, Mubarak has shared a link where you can share your feedback, and we'll be very glad to receive your feedback. If there are any questions, anything you would want to say, suggest to make these sessions better, it's always going to help us, because over here the purpose is to gift a life, and I'm very glad that Mubarak started with this, like took this initiative and is going on with this. So I'm very glad somebody has finally started this. Okay, thank you. It was very okay. Thank you so much, Shiza. I'm glad I could do that. Any other questions?
Ashna, before you wrap up, if you remember, there were a few clients even before the session who want therapy. So if you can please share how you're practicing and where you're practicing, if someone wants to reach you out for therapy, since you are practicing, mashallah. So how they can reach you, if you can share with these people. Obviously, we're going to share it on the page as well, but abhi in logon ke saath agar aap share kar sakein.
Sure. Okay, so yes, I am seeing clients. I am taking sessions for now, and if you want to reach out to me, I'll share the details with Mubarak, and if you want to reach out to me, you either contact Mubarak, or I'm going to just write my email address over here. So if you don't feel comfortable, or you just want to directly reach out to me through this email ID, right? But agar aapko number chahiye ya WhatsApp, through WhatsApp, of course you have to drop a message for that. So I'll share those details with Mubarak, and that will be like in DMs. I'm not going to share it over here. I'm just sharing my email address over here. Okay, so here it is. You can save it if you want to reach out to me for therapy or any such issues or anything that was unclear during this session, or anything you want to ask after this. So I'll be very glad to help you out with that.